They sat me down and they said, Abby, you have a brain tumor and we can't let you leave. You know, we have to do immediate surgery. I had a blood transfusion and 2 platelets transfusions.
My husband ran and got the nurse practitioner, and she came around the corner, and as soon as she saw us, she said, he's gonna need a blood transfusion. But just hearing those words definitely helped me have some hope.
Without the gift of blood, I wouldn't be here today.
My son wouldn't be alive today without those donations.
Blood Bank of Delmarva has a wonderful and rich history of service to our community. And all of our success is due to the exceptional support we've received over 6 decades from businesses and government leaders, organized labor, churches, schools, organizations, and individuals. Hundreds of thousands of people have joined and supported the Blood Bank over the years as members and blood donors.
Each year, at hospitals throughout Delmarva, more than 20,000 patients require life-saving blood transfusions. They may be accident victims, children with leukemia, mothers of newborns, or people undergoing routine surgery. The blood they receive is donated by dedicated volunteers.
Just the good feeling of helping people, sometimes you can't do a whole lot. This is something that you can do.
It might hurt for a second, but then think of all the benefits that you're doing for other people and how in the long run it'll definitely be worth it.
This is hopefully going to get somebody to help them out. I think 30 minutes of my time is worth saving somebody. That's all I see.
They're doing that. This small act has a great effect on other people who really need the blood. It's a rewarding feeling. that was the best part.
But where do these heroes go to donate their blood? They come here, and here, and even here. At Blood Bank of Delmarva, people give blood in modern facilities and on specially equipped bloodmobiles. Their blood is processed by highly trained technical staff and screened using state-of-the-art testing equipment. It's then available to save the lives of thousands of patients each year on the Delmarva Peninsula.
Our son CJ had a stroke, and it's because the blood cells, backed up because of a sickle cell condition. And so without the blood transfusion, a sickle cell kid is really lethargic. They start to fade away. It's highly likely that he would not be living without blood transfusions.
We were rushing to ER and we were admitted to ICU and we didn't know if our son would live. 1 month of age, he probably had 4 to 6 transfusions in a week. He is now 8 years old and he's had 137 blood transfusions. Red blood cells keep him alive. Every cell in his body is donated.
Donor centers are located in Wilmington, Christiana, Dover, and Salisbury, with mobile sites within a short drive for anyone on the peninsula. Many give blood multiple times each year. They may have joined the blood bank where they work, or students giving blood at their school blood drive, or on-call members of the blood bank's Lifesaver Club. All are people who care enough to answer a request to help someone in need.
Got an email, I think yesterday, the day before. I'm an able-bodied person, why not come in and help out?
We have a more obligation to help other people. Think about if you'd be in that situation, you needed blood, you'd be really thankful for someone else's blood.
But how did we get here? In the early 1950s, with Delaware's population booming, hospitals and other public services were near capacity. The blood supply was unreliable, and dangerous blood shortages were common. Patients who needed blood were burdened with finding 2 donors to replace every pint used. In 1954, Jim McCluskey, a Wilmington insurance executive, thought there was a better way. He had the idea of a walking blood bank. People walking around on the streets of Delaware would be the blood supply. They would all be members at $1 apiece, take a turn giving blood, and they would receive coverage for participating. He and other community leaders put together a formal plan. McCluskey passed around a hat, and each put in $1 to become the original members of Blood Bank of Delaware. With unwavering tenacity and the help of influential people such as then Governor J. Caleb Boggs, membership grew. Employers and organized labor were important to the bank's early recruitment efforts. Membership soared in the late 1960s after then Executive Director Ken Edwards introduced progressive recruitment techniques. Founded originally as Blood Bank of Delaware, it merged in 1991 with Blood Bank of the Eastern Shore. The combined program brought a stable blood supply to hospitals throughout the peninsula. Today, Blood Bank of Delmarva provides blood for a population of 1.6 million people at 16 hospitals in 13 counties.
Technology plays a very important role in our operations day in and day out. It allows us to be more effective in our processes, more efficient, and I think most importantly, it allows us to focus on safety.
Initially, all blood was collected by the hospitals, and the blood bank recruited members and scheduled their donations. That changed in 1977 when the blood bank hired Robert Travis as its first technical director. Travis, who later became the bank's CEO, helped change the program to one that collected, tested, and provided blood and blood products to the hospitals. Blood transfusion science has continued to advance, and with it, the technology to help blood banks serve more patients. Expanded testing programs keep blood safe from a wide range of diseases. And innovative technology was adopted so that donors could give specific parts of their blood, such as platelets and plasma. Blood Bank of Delmarva was also the first in the nation to offer diabetes screening that has given hundreds of people early warning of high glucose levels. The future is bright.
The key to growth is leveraging our technology, continuing to invest in our people, and making sure that we have the talent to operate the organization into the future.
The Blood Bank's reputation, earned through 60 years of service, is one of excellence, innovation, reliability, and safety. It serves our communities well, enlisting our friends and neighbors to help each other. Throughout its first 60 years, changes and challenges have been the norm. As with other enduring programs, the Blood Bank's board and staff have adjusted when needed and pursued the path necessary to advance its mission. It has indeed been true to the motto it adopted 60 years ago: the greatest good for the greatest number at the least possible cost.
A couple minutes of your time, it can save someone's entire life.
You know, to come in and donate blood that people have no other way of getting, I mean, that's kind of the greatest gift you can give.
I'd like to personally thank these heroes. It is their willingness to sacrifice time and a part of themselves that make it possible for countless patients to survive their injuries and illnesses. These donors have made it possible for us to fulfill our mission, and we are truly grateful.
I guess one of the messages that I would really love to say to donors is thank you.
Thank you, blood donors.
Thank you from the bottom of our heart. Thank you so very much.
You are saving people even if you don't believe that you are.
Thanks, blood donors.